Dr. Emma O'Brien, who holds a Medal of the Order of Australia, is an internationally renowned innovator in the area of the role of music in health and well-being. Emma founded and remains the director of the music therapy program at the Royal Melbourne Hospital, but she does so much more than that. She was the CEO of the Institute for Creative Health, which generated some infrastructure in arts and health across the nation of Australia by creating leadership groups, one of which became the Arts Health Network New South Wales ACT. Emma is a great breaker down of walls and reimaginer of services in all sorts of directions. Emma, I'd love to hear your thoughts about what might be possible for us in the aftermath of COVID with the potential for the creative arts in health services and healthcare.
Right. Well, thank you for having me, and what an extraordinary morning we're all having. I'm actually at home, which is why I don't have a mask on, because I'm in Melbourne and we're in pretty intense lockdown, and I'm still practicing at the hospital, but I stayed home so I didn't have to wear a mask. If I was at the hospital in my office, you can see the sun's coming through, I would have had to have had my mask on. So first of all, thank you to all the presenters. I think you'd all agree it was really diverse. And what really struck me though, despite the diversity, is that kind of feeling of how we connect. Vic said it beautifully about being a creative person in a space, engaging people. I've been working at the Royal Melbourne now for over 21 years. And it's interesting, Vic, you brought up the concept of a tool. I've never actually seen my work as a tool at all in the health service. I've seen myself as part of the team. I've been embedded in there, and because of that actual time and relationships, we have never been so busy as we are now in this current pandemic. I can't even begin to tell you how I cannot keep up with the demands on our service is almost the wrong word, on what we're doing, on how we are using music to engage, to support people, on how we're able to think a little differently. I'm very privileged to be part of a fantastic allied health management team as well. And my role in that team, and you can ask my director, she'll agree, is because I think like a creative person. I think a little differently. And I think that is really also what we've got to hold on to. It's not just what we can create and make, it's how we think differently. And I think that will see us through this pandemic too. My PhD is actually in creating original songs with patients. So I totally connect with that idea of how we are conduits for other people. I see myself as a creative person who works at a hospital. I see my team in the same way. And I also see all the people that I'm working with the staff and the patients as also creative people. You know, I do work on the philosophy that we all have a song inside of us, and my job is to help that song come out and to help with that storytelling. And Vic, you showed that beautifully. And also Katrina, you showed that as well, how arts can just maybe, sneak's not the right word, but can get into a way or bring people together so that we can actually get on with some of the more kind of, I suppose we call institutionalized things that we need in health. I mean, we do need to get our blood pressure checked. We do all need to get tested for COVID. All these things these are things that we have to do to be safe. And I was also really enjoyed the presentation around research. As a researcher myself, clinician researcher, we're very much about, let's look at things that we're researching in the space that can have an impact that's ongoing, that's sustainable. There's definitely an issue around how we fund arts in health. We're very project-based, like, you know, and Vic, I hope that your work continues to roll out, and I might buy myself one of those little music machines you've got. The idea that the way we've worked at the Royal Melbourne, and I hope that other people can do this, and I've certainly replicated this at Chris O'Brien Lifehouse. I'm also the music therapy fellow there, and I I used to go to Sydney to see everybody, but at the moment it's all happening via Zoom, and set up that program there because I'm really about how we can learn from each other, how we share information. I'm totally against barriers. I'm also very much against the barriers of, there used to be the old school of therapist as opposed to artists. And yes, I'm a trained music therapist. I've got too many degrees and all those sort of things, but I am in essence a creative person working in a hospital, and currently I wouldn't want to be anywhere else. I'm really interested in the concept too of research and how you talked about the linear nature, and there's really nothing linear about life. I think, everyone must remember the concept of the stages of grief. There's nothing linear about grief. There's clearly nothing linear about a pandemic. We're going back and forth and back and forth. And this whole concept of complexity science, and hospitals do work as complex organisms. We are consistently looking at what's in front of us. What is that given need that is right there? And then we're also trying to think strategically. How can we ensure that people get what they need in an ongoing way? How can we manage the way we're funded? How can we evolve consistently? And I think that the arts and the artists and creativity is perfectly placed for this. We think differently. We come up with everyone goes, well, that's really ingenious. And whereas for us, it's like, oh, that was just sort of what kind of popped into my head. I was very privileged you talked about, Michael, about person-centered care. And so in 2011, I won a Victorian Public Health Care Award, myself and my team, for enabling person-centered and family-centered care. And I thought, oh, I didn't even realize that was a thing. I was just doing what I was doing. And I think those things come very naturally, because you can't actually be in art, and I'm sure you would agree, Vic, you can't, and Katrina, and also Michelle, I'm a big fan of all your work. I do believe I once was part of presenting an award to your group. Fantastic. Is you can't be with people in art without connecting and without being person-centered. It just doesn't work. Otherwise, you're just kind of doing to them, whereas very much about being with them. Without a doubt, we are in a time in our lives that's going to define us moving forward. And as much as I hate to go pre-COVID, post-COVID, but I think there is definitely an element of that. And I think we need to look at, I love to furiously scribble. That's my life. There's definitely an element of what we've seen today, which is very pre-COVID. And I hope that now we can look at what we're doing while we're in COVID. Okay, so yes, Melbourne's a little bit more in COVID than other places, but around the world, we are all in this. And that sort of transition between being in COVID and with COVID, with a pandemic, with a crisis. I've been working really hard with my team to try and make sure that what we do is safe. We have to be safe, and we have to show that we understand that. We have to look at, yes, I'm a singer. How do we sing safely? Under quite a lot of protection for us as well as for the people around us. But I'm in a position at the hospital where they still really value that singing. I think if I turned around and said, look, I've decided that it's unsafe, they would say, of course, we understand, and we work with respiratory specialists. We're not doing anything that's going to put anyone at risk ever. But we would find another way. So for instance, on what we call hot wards, it's probably not entirely safe for us to go and sing on there. We'll be geared up, but when you sing, you breathe in and you hold basically the air in a little bit longer. So instead, we'll sing in the hallways. We sang through the windows to one of our units that's dealing with a lot of aged care patients who are, quite unwell. But we sang outside through the windows, and it was absolutely beautiful. They were waving and we were singing. I went back to my old kind of operatic days as an opera singer. So there are ways for us to move forward and be in COVID and with COVID. And I look forward to a time when we're post-COVID. I think, that may be a way off, but I'm pretty sure that the arts can negotiate that. We can find a way through. I wouldn't want us to all think, oh, well, we're not going to go back to anything until it's all over. I think we've got to find a way to work together and to continue to provide the service. I made quite a big pivot. I'm basically a bedside clinician, and I also work obviously managerial stuff as well. But I made a very big pivot at the beginning of lockdown in March towards staff wellbeing and working with the staff to help them, caring for the carer, and arts can do that beautifully. you might, if you want to have a quick Google, you can find we did a, one of those choirs with all our faces and people moving. We're in the middle of doing another one, despite we're in the middle of a pandemic, because what's really been driven home for me is we can create a little moment in the arts, and obviously I'm going to be rah-rah for music, but we can create a moment, and that moment will go on for that person for the rest of the day. So it is actually meaningful to sing in the hallways. We used to have 38 volunteers coming in and doing that for us, but we can't now for safety reasons. So now my staff and I are doing it. It's never been so impactful for us as well. Normally we play and people, we get a nice nod. Now people are either singing along with us, under their masks, or crying. We're getting thank you letters from staff because, things have been really full on, but they heard that song and they carried it through their day. So that's been extraordinary for me. I've also been able to use my creativity in songwriting. I've written 3 songs with the whole of the staff. Don't ask me how I did it. It was an altered state without a doubt. And you mentioned that, Katrina, about finding a space in art that isn't here and now, but it's a creative space. It's so healing, and I certainly got a lot out of it. 260 comments, 3 songs. They'll be coming. We'll be, sharing them. We want to share them with the public about our experiences as healthcare workers. And I say our because I really do feel embedded. My team is embedded. We're really valued. There's no argument whether we're essential or not. And I think also the whole concept at the Royal Melbourne and also at Chris O'Brien Lifehouse is that we are all about connecting with our patients. We're all about being kind to each other, and the arts can actually do that. Music can be really kind. It can be a little bit confronting too, but it can do things simultaneously. When you play a song or hear music, one person will sob with that, another person will find the most uplifting thing they've ever heard, and I think that kind of duality in the arts is really relevant and is what we need now. I have become a bit of the rah-rah girl for, yes, we are essential. I've done a few interviews and they've all said, but surely at the Royal Melbourne when everyone was going into lockdown, it was like, well, who wants music? And I said, no, it actually was the exact opposite. So we have our clinical areas that are non-COVID that we work in, and we're trying to offer safe services there. But we also have a service that goes right across the hospital for, general referrals, and they have gone through the roof because people are so stressed. Coming to hospital now has never been so stressful, and if we can help people release and let go, that's what we're doing. And I think we do need to embrace technology, and I love watching. I know we're all a bit zoomed out, but there are ways we can connect. We're now offering to Zoom with patients, and their families at the same time, so they can have some music, to have that connection. There's something about the human being playing to you and with you, and certainly I always feel that we're responding to where we're at. And I think, I think back to what you were saying, Katrina and Michelle. I know you guys have created this beautiful space where people can come to. But often in health, we don't have those spaces. We kind of inherit a space. But the arts can transform that space. You can walk onto a busy day centre, and it's sort of a panic and a feeling of this, everything's really, and let me tell you, things are dialed up at the hospital. As soon as you start to play, you almost hear a sort of environmental collective sigh, and, enabling people just to bring it down, settle in that space. Sometimes we do silly movements in as well, but it's also that ability for the arts and music to transform a space, and because we do inherit where we end up. I would love to take questions if we could. I think if we can be as interactive as possible, that would be fantastic. And I just want to thank all the presenters. I want to make sure everyone stays safe. This is a really, really tricky time, and to really look after people that you know, and to share that kindness with one another, I think is so, so very important, because, we are, I'm going to be rah-rah and say, hopefully we come out on the other end and we're all, with people that we're together, and it's important. And we can use the arts. Everyone can use the arts, and I hope that we keep talking with a mask on if you're in Melbourne and a shield if I'm at hospital.
Thank you so much, Emma. Emma Unmasked.
It's like the Masked Singer. That's coming on telly, isn't it? That's hilarious.
That's true. We must have a COVID lead for the Masked Singer. We are going to spend a little bit of time taking some questions from our audience, and all of our speakers are available today. And the first question is for Michael Hodgins. It's from Phil Orcher, and he asks, do you think art supports health literacy for patient receptive care and also informed care decision making? In a way, I think Emma's already answered that question by saying that patient-centered care was seen as key to her practice. But Michael, we'd love your thoughts on that. Do you think art supports health literacy for patient receptive of care and also for informed care decision making?
Thanks, Claire, and thanks, Phil, for the question. Yeah, definitely. I think that, Vic, Emma and Katrina have already spoken beautifully about it. I think principally the act of bringing art into health spaces, creating engagement and creating opportunity to translate complex health information is really useful for promoting health literacy for patients engaging in health services. I think, as I tried to capture in my presentation, I think the ability to incorporate multiple dimensions of health literacy, not just the biomedical, but also the experiential and the emotional, is really important for engaging patients for health literacy and engaging patients in health services. And on the second question about informed decision making, I'm very interested in the notion of informed decision making, and we know that clinicians, essentially, we think that they look at policy documents as the first point of care initially, but we know that policy and evidence is only tangentially connected to how clinicians are informed by their care. They're informed by conversations with colleagues, they're informed by the experiences that they've lived through. And I think using art as a way to kind of trouble, commonly held assumptions about clinical practice and clinical decision making, as I said, bringing emotion, bringing social aspects of healthcare and lived experiences of patients into the conversation about clinical decision making. And again, as Emma and Vic beautifully kind of stated, the principality of person-centeredness in that conversation, I think, can only empower good decision making in clinical care. Thank you.
Thank you. Thank you, Michael. And indeed, I personally found that Katrina's presentation showed me how health literacy develops in the context of a program like Nangamai. Michael actually has a question for Vic, and it's a lovely question that I think we all might be interested in. Michael asks, have you attempted to capture how your work tangibly changed how the facial nerve clinic practices or how patients engage in the clinic? You are still muted, and we'll need you to unmute yourself to answer the question.
Okay, how's that? Sorry about that. So this research is just over a year in, and it's a 3-year process, or a 3.5-year process with slowdowns because of COVID. So that will be one of the intentions, is to measure what sort of impact placing an artist has on that space, really, as well as approaching direct issues around the face. We're looking at what does it mean to place an artist in that space. I don't have that direct research output just now for Michael or for anybody. However, it is one of the outcomes that we'll be working towards.
Thank you, Vic. This next question comes from Richard Perrin, the Director of HR at Liverpool Hospital. And the question is directed to everyone, but I'll ask Emma to answer first. And the question is, I'm interested in how we can integrate an arts program to improve patient experience, particularly when waiting for something, which we all know that's probably what patients do most of, is waiting. Something timely or immediate, accessible, any suggestions? And I will say after, along with Emma's response, is that we have a wealth of knowledge, I think, around Australia for how to effectively do that in a whole variety of ways, including, I think, in the palliative care services connected with Liverpool. Emma, over to you.
So I agree. Waiting is, we do that quite well in hospitals, don't we? We don't love to make people wait. It's just the nature of being in a hospital. People do have to wait. And particularly in public health, but it also happens across all settings. I think when you're trying to integrate any arts project in, it's really important for whoever's coming in to do a lot of research about where they're going to. I think sometimes arts programs will fail because people will turn up and say, hey, I'm doing this world first thing, and you know, I'm going to put music in a waiting room, and everyone will say, oh, okay. But in fact, a lot of people have already done that, and so there's a lot of work to do around what people have already done, and to talk to people that are already doing it, but also to look in your whole setting, in your hospital setting, because, you know, the arts aren't just something that all of us do, or just artists do. Where I think the pandemic has certainly shown us that. There will be a lot of key people that are already working in the areas that you're talking about and in your hospital that are in fact wonderful singers, wonderful artists, incredibly creative people, and you need those champions on site with you. In terms of how you're going to help people cope with waiting, look, I'll say pre-COVID, I would have said the first thing I would do is put a live musician in there. I know there's just opened The Age. I love reading The Age on my phone today, and there's this whole dialogue around please don't pipe music into hospitals. I think there's a group called Pipe Down or something, which I thought was quite interesting. And there is a lot about putting recorded music and how, you know, I'm pretty sure I wouldn't want to hear recorded music piped into my room all day because it becomes a bit of a background noise. And I think there's a lot of value in the purposeful use of music. And we've certainly found that. I know people mean well when they put a radio on, but well, it doesn't take much, so I suppose you don't normally slip to static now, but I have actually walked into rooms where patients and someone's, you know, they meant well, they put the radio and they put it on Classic FM, that they didn't actually engage with the patient about what music they wanted. And at some point someone knocked it and this was happening and the person was in their bed. So I think there's a danger around recorded music. I think you can use it, but it can seem a bit like an elevator lift, and it's not going to respond to the space. A live musician, and even within COVID, if you have someone in there with a full mask on, if they're not singing in particular, there'll be less risk as well for them. And then they're playing there, they'll be able to respond to that environment, and they'll be able to pick up on what's happening. Particularly if you've got a group of people waiting. So I think my key things is make sure you research your space as it is. I think the artist needs to link in, or the therapist, with other people that have done it, and also to not try and reinvent the wheel, and to really do it in partnership.
Sorry. Would you like to make a point? Yeah.
Sorry, I was just going to add to that, you know, in thinking about what art brings to a space, we need to foreground the idea of relationships. And it's about facilitating relationships. So waiting, what makes waiting sort of problematic or sort of difficult is that there are no opportunities for relationships, and there's no possibility for action, for activity, for being active in a space. So I think if one can actually conceive of art as a means for facilitating relationships and, you know, agency, then that will help us to think about what programs or what things can happen in spaces. And obviously the pipe music is the absolute opposite of that. It's not about a relationship, and it's not about being, you know, active. So, you know, just sort of starting to think about it differently in that way.
And that's that connectivity that I was saying. If you have someone live, they can respond not only to, hey, do you know you know, if you knew Susie, but they can respond to the feelings in the room. You never please everyone. I go by the 80-20 rule. I don't check in with everyone because it's just the way the world is. But I think I think that will help.
And I think it's a great idea to look at interactive art. So a lot of the hospitals that Michelle works in and a lot of spaces we've exhibited our artwork, it's made a great difference to the actual space. However, none of it's interactive. So if I'm there with my young child and we're both anxious because we're waiting for a procedure or whatever it is, it'd be great if that stuff was interactive and you could have, you know, a button you press and it tells you about the artist and what they wanted you to get from that artwork or whatever it was. And in the same way, thinking about not only somebody coming out and singing, but, you know, those things like the clown doctors and people that are just there to kind of engage you, all that helps with anxiety. The amount of anxiety you feel as a parent, and I'm sure children are 100 times worse, when you're in a space of waiting for a procedure or to find out some results, just having those little things to be able to distract your brain or to kind of calm you would be so useful. I just wanted to add that, sorry.
No, it's a wonderful addition, and I like how we're already exemplifying how you bring the artists in and they start to really think creatively. It's almost time for us to wrap up, but I know that Vic had previously undertaken a project that allowed people to work with the sounds in a hospital on their own terms. And I know one of the challenges in a hospital environment particularly is always around infection control. So buttons that you push and things that you touch become sites of infection risk. But being able to control sounds or explore them or change them or to work with projection that you can access by only touching one device might be one of many methods that allow us to engage with this. So Vic, if you have the last 2-minute statement to make, the floor is yours before I thank you all and we close this OnCon.
Gee whiz. So, you know, in terms of particularly about sound, I think what I will speak to for the last 2 minutes is that project which looked at the negative effects of sound within our hospitals and the research that tells us that sound within hospitals is causing things such as increase in length of hospital stays, increase in medication use, etc. Started from a very open-ended process. And so the idea was about what would happen if we placed a contemporary artist in this space to look at this issue. And so there was no predefined outcome, because by predefining the outcome, we predefine the outcome. We already know what the answer is going to be. We know there'll be benefit from the human engagement of an artist. We know these benefits will happen. But by allowing a process of you know, I say it to myself privately, of being lost with the patient, just as a patient is in this loss of this unknown position of being at the mercy of a hospital, at the mercy of their illness, at the mercy of the unknown. By taking a contemporary artist and placing them in the unknown space for them of a clinical space, there is a relationship that can be built there, and that's a relationship of human beings. And so in terms of that project, we're able to look at some of the real practicalities of the sounds that exist within hospitals and how we can do some simple things to stop those. We could look at some of the more poetic notions of about the sounds that exist within inside our body, for example, our heartbeat, the way blood moves around our body, and a commonality between all of those things. So we all come to these things from very different perspectives, and I think that's some of the richness of an arts and health practice. And my perspective really speaks to an understanding of the connection between human beings that can be had through artistic practice within the clinical space.
Thank you so much, Vic. And in many ways, this conference and the conversations that are going on throughout the connections between arts and health are hopefully emboldened by the capacity to be lost for a bit and not know where we're going. And we all know we want health services to change and shift and grow to become more fit for the populations they serve in the 21st century with its many challenges before us. Thank you so much to Robin and Michael and the people who have supported and enabled the Create Centre, to all our wonderful amazing participants. It's a great joy to have you part of this OnCon and to have you as professional colleagues. And to all of you who accompanied us on this webinar and listened in ways where we could not see you, but we hope to connect to you into the future, please come and visit the Create website. Please come visit the Arts Health Network New South Wales ACT website. Subscribe to us, follow us on social media. Join with us as we reshape a world in which both creative arts and health are central and intrinsic to each other. Thank you very much.